popping in front of that. But what the governor did in Executive Order number 50 was he noted the provisions of Executive Order 49 and amended 38. You don't have to worry about all the numbers. Basically said in Executive number 50 that all those things he said in those prior orders were going to remain in full force and effect. And Executive Order 49 also made it clear that senior centers were to remain closed, and that was the language that you can see if you're watching. Senior centers or equivalent facilities shall continue to be closed to members, customers, or the public. And then there was the added language that they said, provided that staff and volunteers may provide services via electronic or virtual means as circumstances permit. But again, the facilities themselves were based upon Executive Order number 50, following up from both 38 and 49, said they are to remain closed. Okay, so they've got to be closed. Next slide. There it is. Made it very clear. Governor wants those senior centers or equivalent facilities closed. Okay, I'm trying to make it very clear what the governor told us, what he said in the executive order. All right, next slide. Now let's see. Wait a minute. Yeah, go back to slide. I think we missed one. Okay, yeah, that's it. So basically, again, your centers are supposed to remain closed. That is straight from a governor's executive order. And to be very clear, I think the governor's office has been very clear and firm on a number of different things, including this one. We have gotten instructions directly from the governor's office that opening up the senior center prior to the termination of that executive order is both a violation of the governor's executive order and the laws that provide for the order's authority. So when a governor issues an executive order, it's not like the General Assembly is passing a law; it has to pass the House and Senate, blah blah blah. The governor has authority to execute and run the government of the state of Tennessee, and those things that we have any type of authority over. They have looked at senior centers. TCAD doesn't have authority over senior centers. We obviously work with you all and provide some funding, but we don't have the authority to shut you down. But the governor does, based upon the authority issued to him and or her. But in this case, Governor Lee has the authority to do it. They have made it very clear to us on numerous occasions that you are to remain closed. And I think that what they also want to do is make sure that they don't give you an unnecessary that they don't mislead you in any way. So at this point, we've been given no indication that they plan to allow them to open up at the end of August. That may, in many ways, depend on the numbers that are floating around at this point. I think they've been trying very, very hard to get the COVID-19 numbers under control, and we just keep a daily look at it just like everybody else. But a lot of this is, sort of day by day, week by week, and then they have to make a call. So again, opening up is a violation of, you're basically saying to the governor you're not listening to him. We would strongly recommend that you do listen to him. He has the authority to do this. Executive orders are to be followed. So senior centers are to remain closed based upon that. Next slide. So again, I know we're stressing this, but we've been asked to. The training is designed today to prepare you and your centers the days leading up to the opening, and then when your facility is actually open. So they have, again, strongly recommend to say very clearly that we're not at that point yet, and senior centers are closed. Again, so this thing is really designed to get you ready for when they say it's okay to open. But again, we're not telling you that they're even close to that at this point. But again, we let you know as soon as we know something. I know you're anxious to open. I know you've got folks that want to come back, but this thing is really kind of scary out there, and I think they are trying very, very hard to make took sound, correct decisions on all this. Okay. Next slide. Good. That way I can stop telling you the same thing over and over again. All right, so I'm going to turn this over to Emily Gately, who will take it from here. I really do appreciate everybody's efforts. I know this has been very, very difficult. Everybody is highly stressed and trying to make good, sound decisions. We're concerned about the senior centers. We're concerned about your operations. We're concerned about the folks that come to your senior centers. We're concerned about social isolation. We are working on different strategies up here to help you in any ways. If we can, just let us know. We're here. Let your AAADs know, or you can call us directly. We know that this is very, very difficult. You're balancing all those different things about opening as compared to, we got to keep our folks, the folks that that come to our centers are the most at risk with this thing, and we want to keep them safe and healthy, and that's a serious concern. So we're trying to do the best we can. Anyway, thank you, and Ms. Gately, now you can get into what the main part of this thing is about. Okay.
Thank you, Jim. And as Jim said, you know, we really wanted just to give you all some tips and some guidance that might be helpful in planning for reopening your center. If and when that happens, we just wanted this to sort of hopefully provide you some tools in that planning process. And so even no matter what you do, there will always be risk, but we know we can reduce some of those risks through social distancing, screening, and cleaning and protecting the people, cleaning the center and protecting the people who come in your center. So as far as social distancing, we've heard a lot about that, and really that is one of the best ways to prevent the spread of COVID-19. Some ways that you can do that in your center is to limit the number of participants in the building, preferably to 50% of fire code capacity, and that will help you maintain that social distancing or that physical space between participants. 50% of fire code is what we recommend, and if you're not sure of what that is, you can reach out to your local folks or reach out to us, and we're happy to try to help you figure that out, but 50% is preferable. We also recommend spacing your tables at least 6 feet apart, or if you're not using tables, make sure you separate chairs at least by 6 feet. If tables must be shared, try to limit the seating at each table to no more than 6 participants, and really even less if you can. So keeping that physical space in between participants, volunteers, staff, whoever is in your center, the more physical space between, the better. Encourage your participants to limit their contact to small groups of consistent individuals. So instead of having people maybe walk from one table to the next throughout the day, try to limit it to maybe you're in this group, you're at this table of 3 people, and that's sort of the group that you're spending your time with, instead of rotating or that sort of things, because that just minimizes the number of individuals who are coming in contact with each other. Another suggestion is to remove all shared materials. I know this can be difficult, but things where everyone is touching the same thing, right? So books, ink pens, magazines, games, playing cards, a lot of those are things that we love about our senior centers, those materials that really allow us to have that shared experience. We're going to talk at the end about some ways that you can still have those activities, but maybe minimize the risk a little bit more. So remove anything where it's a lot of people touching one item, that just can be a way for germs to spread. We also strongly suggest you do not host or offer any sort of potlucks or congregate meals at this time. We know that potlucks have been a source of COVID-19 outbreaks in other states, and so that, by nature of having shared materials, shared items that everyone's touching, that sort of thing can pose a risk for transmission. At the same time, we do want to implement activities that can encourage participation in social distancing. At the point, whenever it is that your centers are allowed to reopen, we want to make sure that our participants and community members are able to participate and able to get those benefits from your center, but we also want to make sure they're being safe. So try to think of activities that people can still participate in, but still remain socially distanced. This one may seem a little bit random, but it has been shown to increase transmission risk. So avoid singing. So whether that is we're all singing together, whether that's sort of happy birthday or a performance, try to avoid singing. Singing, just by the nature of you projecting your voice and sort of singing more loudly than you probably would talk. It has also been shown to increase the chance of virus transmission, just because you're sort of projecting that air across further than you would if you were talking. So try to avoid singing. And then increase electronic and remote participation opportunities. That's a really good way to social distance and keep this physical space between participants while still sharing the benefits of your senior center with those participants who normally would participate. So that way they can remain at home or participate at a distance and still get some of those same benefits. And we'll talk some more at the end about ideas and ways you can do that. So this is an important one. We ask that you screen everyone. So you're probably familiar with this either through your own workplace, a loved one's workplace, or other places you've been in the community. But a suggestion would be for every day, and it would be each day, you would ask your participants and volunteers and staff, have you been in contact with a confirmed case of COVID-19 or anyone experiencing symptoms within the past 14 days? That way you can potentially catch a case or someone who may be at more risk before they enter your facility. So just ask them, have you been in contact with a confirmed case or anyone experiencing symptoms within the past 14 days? So you also want to note that doesn't apply to medical personnel or first responders, because obviously if you're a nurse that's coming in, you're most likely you will have been in contact with the case. So that is an important exception. But in general, everyone who's just a member of the community, you want to ask them, have you been in contact with a confirmed case in the past 14 days? You also want to ask participants, volunteer staff, are you experiencing a cough, a shortness of breath, or sore throat? Those symptoms I know can be kind of general. We live in a state with allergies and everything else, but that's really important to ask because we have seen that in COVID-19, some of the symptoms can be very, very mild. An individual may not even know that they have it. And so simply asking that question, cough, shortness of breath, and sore throat, those are the most common symptoms. Asking that can really prevent someone who has an active case from coming into your center. Have you had a fever in the last 48 hours? Have you had a new loss or taste or smell? And have you had vomiting or diarrhea in the last 24 hours? Do you want to ask these to anyone coming in your center every day, really trying to prevent anyone who may have it from coming into your center? That's not going to catch every single person who potentially has it. We know people can be asymptomatic, but this can greatly reduce the risk that someone who is coming into your center has a current case of COVID-19 or is contagious. You also want to temperature screen all employees, volunteers, and participants upon arrival each day. So you want to do that before they come in the center or right at the door. You don't want it to be, after they've been there 10 or 15 minutes. But you want to take the temperatures with a no-touch thermometer. Every center at this point should have a thermometer. If not, we will help you get one for your center so that you can take temperatures of everyone who walks through the door. A normal temperature should not exceed 100.4. So that's an important limit. Sometimes you'll see people who have a temperature of, say, 98.8. That's okay. But a normal temperature should never exceed 100.4. And if anyone answers yes to any of those screening questions, or they have a temperature of 100.4 or higher, You want to ask them to leave. You want to ask them to talk to their medical provider. And you also would encourage them to get a COVID-19 test. COVID-19 tests are free at every local health department. Doctors' offices will provide them, but local health departments are absolutely free, and that is a good resource for anyone who comes into your center that either answers yes to a screening question or has a temperature. An important consideration also is make sure that you maintain that person's confidentiality. You don't want sort of rumors to start that that person had to turn away. They probably have COVID-19, anything like that. You just want to ask them, please, we would encourage you to talk to your doctor. This is just our screening protocol. Obviously, someone could have any number of these symptoms and not have COVID-19. You just want to be really respectful of that person's confidentiality and making sure that it doesn't sort of spread a rumor or start a rumor and start fear throughout the center. Just be really respectful of that person's confidentiality if you have someone who you ask to leave and talk to the doctor or get a COVID test. The last thing we recommend is really to clean your facility and protect those folks in your facility. So the first thing is to post signs about washing your hands, maintaining social distance, and others. Every senior center in the state who we have their info through the AAADs and others will be getting a packet of posters. They should be arriving sometime next week with posters that you can use in your center, as well as some additional information and resources for you. So post signs everywhere just as that helpful reminder of washing your hands, maintaining that 6 feet distance. You also want to place hand sanitizer stations or hand washing areas in several locations throughout your center. Make sure that it's not just in the bathroom and in the kitchen. Put them anywhere and everywhere. We know that when people see that visual reminder to use hand sanitizers or wash their hands, they're more likely to do it. That's a really easy way to sort of prompt that good practice. Another thing you can do is to, weather permitting, obviously, open the doors and the windows. The more airflow that's going to help sort of if there is a virus or really any kind of germs, that'll help circulate the air and keep transmission a little bit lower. You also want to regularly clean and disinfect high touch areas. So think about those areas where multiple people's hands would have touched. Thinking about doorknobs, faucets, tables, and other areas like arms of the chairs, or if you have a place where people tend to congregate, really disinfect those high touch areas. And if you need to, you might have to adjust your center hours to allow time for that. We know that a lot of centers don't have, extra staff that is going to be able to spend hours and hours cleaning after what the normal hours would be. So if you need to, talk to your board, talk to whoever your governing body is, and see if you can adjust the hours so that you have adequate time for cleaning and disinfecting. You also should think about removing tabletop items. Again, those are the items that people would be touching, multiple people touching the same surface. So things like sugar packets, napkin holders, if you have just different items that would be on the table that multiple people might touch, and then so one person touches it, they sit it down, the next person picks it up. That can be a really easy way for germs to spread. And before opening your center, when that's allowed, or at whatever point those executive orders that Jim mentioned, at whatever point that those are no longer a factor, at what point you're allowed to open your center, I think it would be really, I'm encouraged for you to consider, one, has the center taken all necessary steps to make sure that we can ensure safety of employees and participants? Have we, two, developed a plan for cleaning and disinfecting regularly? So it's really important to set aside a designated schedule and a dedicated plan for how we're going to clean and disinfect. I know as exciting as everything is, it can also get really crazy when you're reopening. There can be a lot of moving parts. You want to make sure that you really have a schedule set for cleaning so that something doesn't slip through. It's really easy for something to get forgotten. It's something as simple as we're going to spray off the door handles or the doorknobs if you don't have a really specific plan for when and how you're going to do that. You also want to make sure that you have procured the necessary supplies. So before you reopen, you want to make sure you have no-touch thermometers for that screening. You need to have hand sanitizer and disinfectant. You need to have cloth masks or face coverings for all of the staff and masks to offer participants. So if someone shows up and they don't have a cloth mask, we would encourage you to have some there that you could offer them for them to come into the center. You also want to consider if you've implemented the process to screen employees, the volunteers, and participants. So, make sure that you have the process of having somebody at that door to screen people as they come in. You also want to make sure that you've trained all your staff and volunteers on the precaution and screening methods so that everyone is on the same page before your center reopens, so no one is coming in not knowing what to expect. Make sure that you've provided information and materials to participants. Again, we want to protect our older adults, we want to protect our participants, and we also want to make sure that they have the information that they need to feel welcome and understand what the expectations are and what the center is going to be like sort of under this new normal. So make sure that all your participants have the information and materials that they need. And another thing that you'll want to consider is make sure you have a plan for if there are COVID-19 cases among staff or participants and how you will work with your local health department when needed to monitor and trace. So if a participant does come to your center or if a staff member, go ahead and think about and work on a plan for how you'll deal with that case. Do you have a way to know who was in your facility that day? Do you have their contact information so that you can help Department of Health or the local health department really do their job better of keeping our community safe by making sure that you have a plan for how to know who was there. You also want to have a plan if someone was here on Monday that was a case. We have a plan of exactly are there extra steps we have to deep clean. You also want to have a plan for if staff has a COVID-19 case. So we know that a lot of your centers are operating on a really limited staff. So what's going to be your plan if your staff does have a positive case? Are you going to close the center? Do you have backup staff? Really make sure that you have all that covered so that if or when a case happens, you're not caught off guard and you already have a plan for that. And the last one is to consider if you've attended one of the readiness calls, which you all have because you're here today. So we have a few ideas and that we can go through. Laverta is also on the phone, so I know that she will chime in if I have any mistakes or if she has other things that I've forgotten. And here's some ideas. We know that the guidance can be a lot to sort of think about and process, but there's some really simple ideas. We hope that these will be helpful in making a big problem feel a little bit more manageable from some of these ideas that maybe will help with that guidance. So when you are allowed to open, we want you to think about the meeting those occupancy requirements. So, we talked about that, making sure that there was not more participants in the center than could really safely be distanced, whether that's 50% of fire code or 6 feet apart, whatever that looks like for your center. You want to think about some really practical ways that you can go about that. One way you can do that is ask your participants to schedule ahead the days they want to come. So I know a lot of your centers do that, a similar process for meals where you sort of find out the day before or the morning of how many meals you'll need. You could do the same thing with asking the participants to come to your center. So find out the day ahead if what day they want to come. That would be one way to meet the occupancy requirements. You could also stagger participants, so have folks choose if they're going to come in the morning or the afternoon, or maybe you have a group that comes on Monday, Wednesday, and you have a group that comes on Tuesday, Thursday, whatever that looks like. And then you could you would clean between those groups. So you're keeping making a bigger group, a little bit of a smaller group, and cleaning between them. You also keeping those doors and windows open where possible. Now, hopefully the weather is going to be cooling down, so that'll be a little bit easier, and that will improve ventilation. If you have an outdoor area, once it's not so hot, that will be a great way to really make sure that you're able to socially distance while still providing the benefits of your senior center to participants. Since seats should be wiped down between participants, it might be helpful to encourage participants to choose a seat for the day rather than moving from table to table. So that way you won't have to worry as much about that potential transmission between people sitting in the same chair. You would just say, when you choose your seat for the day, we ask that you stay there instead of moving around to maybe 3 or 4 tables throughout the day. If they are moving throughout that, we would encourage you to wipe down those seats or disinfect it between participants. But asking them to stay in that same table may be a way also to make sure that a few people are in contact with a few people, but it's not as many people interacting closely with each other. Some ideas for sign-in area, and again, these are just ideas. You don't have to do any or all of these, but some things that might be a good way to reduce transmission at that sign-in area where participants come in would be on your sign-in sheet. You should have a sign-in sheet. That way you know how many people are there. You can know when you're maybe getting a little too full every day, and you can start thinking through some different strategies to meet those occupancy requirements. So that'll help you know how many people are there and keep an eye on that. But it'll also help you know who was potentially exposed. So if someone came into your facility on Monday and then on Wednesday you find out that they have COVID-19, you'll be able to go back easily on your sign-in sheet, know exactly who was there, and know that they were potentially exposed, and that will be helpful. Some ways you could potentially reduce transmission at that sign-in area would be to have 2 cups of pen. So you could have one clean and one used, and every time someone signs in, then they just use that pen, put it in the used, and then you can sanitize those with Lysol or something at the end of the day, some sort of spray. That way you're not having, let's say you have a big center and you have 100 people. You don't want 100 people using the same ink pen all day, germs. Everyone sort of sharing that same surface. So you could have 2 pens, the new ones and the used ones, then sanitize them at the end of the day. You could also just have someone wipe them off between participants. And we would also encourage you, that would be a good place to place some hand sanitizer, so people can just use that right as they sign in for the day, and then move along to whatever they're doing next. For food and drink, it would be really a good idea to have one person hand out items instead of having everyone touching the item. So instead of having everyone go up to a coffee or a snack station, have someone serve those items. We would encourage you to use disposable utensils, disposable cups. Same, like use packets of sweet and low and sugar and creamer instead of the one that you would like pour out of. Really thinking about ways you can minimize where multiple people are touching the same item. Again, try not to have like a self-serve coffee or snack station. Maybe that would be a good opportunity for a volunteer. They would obviously want to wear a mask and gloves, but have a volunteer serve it instead of having everyone go up touching the same items. Again, we ask that you don't host potlucks at this time, and that you avoid offering any kind of self-serve, so no self-serve water, beverage, anything like that. It would be a good idea to just do those a little bit differently for right now. So exercise class, I know is something that everyone has been missing and looks forward to eventually being able to do again. Right now, you want to make sure that participants are still 6 feet apart, whether they're using chairs or standing. You can mark out places on the floor or just set the chairs apart, but make sure that participants are 6 feet apart during exercise class. You also want to have a plan to disinfect those shared items, whether that's exercise bands or dumbbells, anything like that. Just make sure that those are getting disinfected between individuals. For things like games or bingo cards, you want to use disposable printed cards instead of those papers that everyone's sharing. I think most of the centers have access to Activity Connection, and there's a ton of disposable or a printed cards that you can access on there, from bingo to games to crosswords, all sorts of activities. You can utilize Activity Connection and you'll be able to find some to print out. That way you're not having shared books or shared cards. You can also give each participant a cup of markers or chips or pens or whatever you're using, and then sanitize all of those before putting away the game. That way everyone's not kind of reaching into that same bin. You can also have participants use like an ink pen or one of these dot markers like you see pictured at the bottom, then sanitize those at the end of the day. That way, you're not sharing or kind of all reaching in the same thing. And I think another idea that we've heard of a lot of your centers doing, which is a really good way to keep that social distance, still maintain contact and engagement for participants who maybe aren't comfortable coming, is to mail packets items of participants who are still socially distancing at home. And you can actually let them call in at the same time as everyone else is participating in the activity. Let them call in so they feel like they're there. It lets them still be socially distancing at home, but participate in the activities with everyone else. And if anyone needs sort of help with any of those, whether it's figuring out Activity Connection or how to sanitize things or how to set up a conference call or free resources for that sort of stuff, please don't hesitate to reach out to us. We're happy to help sort of troubleshoot any of those things. Activities that I know is probably something that y'all have probably thought a lot about over the past 6 months. Y'all probably have far more creative and fun ideas than we've listed here, since you do this every day, but we wanted to give a few ideas for activities since that can be something that's really challenging right now, and I anticipate will be challenging when your centers reopen. To how do we have activities and keep our center fun and lively and everything that makes it so great while still keeping people safe. So if you have things like board games or cards, make sure that you're disinfecting those between participants. If you have a library, say when someone checks out a book or returns books, a good way to do that would be if you still have that library where people can borrow books, when an item is returned, it should be quarantined. So you would quarantine the item, put it away in a box or somewhere where no one can touch it for a week, and then at that point you can return it to shelf. The reason that is because the virus can only live for a certain amount of time on a surface. So if you quarantine the item or really just sort of place it somewhere where no one's touching it or checking it out, then that would allow the virus on a surface to no longer be active, and then you can return it to the shelf. So just quarantine it for a week before returning it to the shelf. Another thing you can do is have a book club, and you can ask your local library or even your local high school to lend you books so everyone can have their own copy. And then when you return it to them, they could do the same process of letting a book sit for a week before it gets back on the shelf. The activity sheets you can print from Activity Connection. I know sometimes printing can get really expensive if that's not something that you do often. So this would be a great opportunity to partner with local businesses and just ask them to donate copies. That may be something that's really low cost for a business, and that they would have no problem doing it and would be a good opportunity to partner with the local community entity. So print those activity sheets. Each participant should have their own so that they're not sharing. Another idea would be to prepare activity kits for each participant ahead of time. So let's say you're having a craft activity or making small potted plants, whatever it is, go ahead and make that activity kit ahead of time so that each one has a kit instead of all like sort of, going to a table and gathering supplies. You would also have your participants similarly do something for nursing home residents or your participants who aren't coming. Another thing you could do is that we love at TCAT and that is really easy to do while staying distance is play brain games. We know that we're not having all of the events that we may normally have, but you could play brain games or do trivia or do name that tune, and they're not singing, but listening to the tune, and those are all things that you can do while maintaining social distance. Garden, that's outside. You can also potentially have either a volunteer or staff, or even one of your participants lead a class on how to use phone and technology for video calls and telehealth. Have someone lead a class so that you can really empower our participants to use that technology to get even more engagement going. Watch a movie, that's a really simple one, but as long as you're sitting apart, that's really easy to do while maintaining social distance. And again, you could have music by a small group. You just want to make sure that it's a couple people or a few people, and that participants are set at least 15 feet away from performers, and that they're still maintaining social distance among themselves. I think that's all the slides we have. We are going to open it up for questions if anyone has questions. And I also wanted to let everyone know that we are going to be sending out a packet you'll get in the mail. It'll have posters. It's going to have a guide sheet, the same one that you guys got in the mail. You will be receiving that probably next week. And so that will have even more resources, more details, as well as some contact information for myself, Laverta, and others, so that you can reach out if you have any questions or any concerns. So with that, Laverta, do you have anything you want to add or share? Laverta, I think you might still be on mute. Okay, well, I don't have anything in terms of slides. I will. I'm going to go ahead and unmute everyone so we can ask for questions. If you have anything you'd like to ask, you can either press *6 or I'll unmute us all just for a minute or two so that folks have a chance to ask questions. So I'm going to unmute everyone. If you don't have anything, you can just use the mute button on your phone.
I have a question.
Okay.
This is Julie White, and I'm here with Kathy. She's our program director in Hendersonville. And I'm a little confused at what you said initially, that there should be no singing, and I've also heard no acting, things like that. Yet in that very last slide, it said to have live singing, so that's contradictory.
So you can have, it's kind of weird. You can have, say if you have like 2 or 3 people who wanted to come in and sing, that'll be okay. But what you need to do is make sure that there's 15 feet between those, couple people. Usually it would be better if it's just one, but there would need to be 15 feet in between the person who's singing and then the audience. And the audience, you wouldn't want them to be singing. So I think the easiest thing to do would just be to not have it. But then if you do, make sure you got that 15 feet between the person who's singing and everyone else, and then the audience, you wouldn't want them to be sort of joining in.
Right.
But
Okay,
I guess
and
the
another
easiest thing would be just don't have it.
Yeah, I think that's probably wise. As far as food is concerned, you said no potlucks, things like that, no congregate meals. But, and this is just my opinion, but in my years of experience, anytime you have food, they like to share it and things like that. So we have just made the determination that we're not going to, until the foreseeable future, we're not going to have anything like that. We're not going to have lunch and learns, anything like that, for the simple fact that we just feel like it may transmit the disease.
Kathy White out of Henderson.
I think that makes perfect sense. And y'all know your participants better than we do. If you think people are going to be sharing, or it's going to be something that people may be doing something that might put a risk, we would absolutely encourage you take the steps that you think make sense for your participants to keep them safe. If that means no sharing of any kind of lunch and learn or snacks or anything, we definitely understand.
This is Laverta. Can you hear me now?
Laverta.
Yes.
Yeah.
We can hear you.
Okay, great. I think, Emily did just a really great job. And I have been watching you all with the things that you're doing with the virtual exercise classes, and, keep those up. Also, you have access to public television and to your local radio stations. You all could be doing storybook hours there. You could be doing pen pal hours. There are so many things that you all are doing and can continue to do. But just like Kathy said and just like Emily said, let's not sing and let's not eat, because, we're vulnerable and we don't want to lose anyone because somebody wanted some of Miss Mary's pie. We just can't do that. So if I were you, I just wouldn't do it. But let's go ahead and let's try to be pen pals with each other. Let's continue to do the virtual programs. I watched Dresden Senior Center do their exercises, and that's another senior center was cooking recipes. She made fried squash. You all have the ideas. Do them, and, keep them informed. But you get local radio stations. Start a storybook hour on the radio stations. Talk with your public TV stations to see if you all can get some free hours and do something there. Everything from, reading and exercises to make a challenge with your seniors. Challenge them to do something once a week. How many people can collect 5,000 pennies? Give them a month to do it. That way you can bring funds to your senior center, but they're still going to be out collecting stuff. Or who can grow the biggest apple? This apple season is coming. Who can collect the most apples? Or who can just things to challenge them. There's so many things that we can do. I know you miss each other. I miss my coworkers, but we want them alive. We want to miss them for a while, not forever. So Emily has given you all everything that she can do to help you all stay safe. And remember, she does have a master's in public health. She knows what she's talking about. So we're so blessed to have her on our staff. So if you all have any questions at all, email her. Let her know what you're concerned about. And, email me. I'm still here. I'm at home, but I'm still here. And always go to the National Institute of Senior Centers to see what other senior centers are doing across the country. You all have access to that. And many of you all have that, My Senior Center, so you're swiping cards, so you're not going to have to worry about the ink pen. But still, follow what she said. She's done a marvelous job. And, like I said, you all email her if you have any questions. I'm glad you can hear me now.
Well, I'm glad we can hear you too, Laverta. Thank you for those really nice words. We did get a few comments or questions on the chat panel, so I'll go ahead and read those. And again, if y'all have any questions, please don't hesitate to reach out. We really, I think we all really want you to know that we're here for you during the process at whatever point you are able to reopen. We are here as a resource. We want to support you and make sure that you can do that safely in a way that serves you and serves your seniors the best it can. So we did get a question about, will we get a copy of the slides from today? We are going to send out a copy of the slides. We're going to send out a recording, and we are going to host a second webinar at the end of this month on the 26th for anyone who is unable to attend today, so that everyone has a chance to ask questions and everything. So you'll get a copy of the slides, you'll get a recording, and we're going to have a second. It's just going to be basically a duplicate of this where we sort of go through these same slides again. And you'll get the recording and slides probably tomorrow. Another question was, will those packets be sent to the senior centers or to the AAADs? We're actually going to send those packets directly to the senior centers, so that'll hopefully save a little time for the AAADs. They won't have to send it out, and hopefully that way you'll just get them directly. But we can also send a copy to the AAAD so that they have some. But just be checking your mail. They are pretty they're posters, kind of a large packet, so just keep an eye out for that. Someone else said, are there recommendations for mask wearing during exercise? We encourage you to wear masks and face coverings. I know different local jurisdictions have different requirements, but we encourage mask wearing even during that exercise. If you're doing something, just crazy, if you're running a marathon or something, that may look a little different, but we encourage you to wear a mask whenever possible. Someone said, will supplies be provided to senior centers to help with sanitation or temperature checks? So we have ordered thermometers. If you have, what we ask you to do in terms of supplies for sanitation is try to get those through your local, however you would locally, like if you get those through, if you're housed within county government and you get them from wherever they get their supplies, or if you get your supplies through Walmart, whatever that looks like. But if you run into trouble and you can't get the supplies that you need, say, I've tried, ordering bleach at Walmart for the past 2 times and we just can't get it. Reach out to us. We're happy to help you procure those, whatever it takes to keep your senior safe. Same thing with thermometers. If you need a thermometer to do temperature checks and you don't have one, please email us. We're happy to see what we can do about getting those for you. Someone said, if we're not sharing pins, how can members play cards or puzzles? I think the best way to do that would be to make sure that everyone has their own. So, buy a couple boxes of pins and have everyone use their own. And then at the end of the day, you can, dump them in a bin, spray them off with Lysol, let them sit overnight, and then you'll be ready to go the next day. Another option would be just ask people to use their own, but not share them between participants. Someone said, I have a question about spacing. I've seen sites where they mention taking your programmable space, getting square footage, and dividing by 113 for the number of attendees. Our fee is only less than 6 people. Is that a fact, or do we go by our fire department and their figures? I don't know the answer to that, but I'll look into that and get you an answer. We'll include it when we send it out. I would say the best thing to do would be to reach out to your local, what do you call them? Fire department, or the person who does your fire inspections. Code. Thank you, Laverna. And then ask them, and then ask whoever your local governing body is would probably be a good way to go about it, because they'll know what the rules are in your area. As we've seen, metro areas may differ than counties and different things, but I'll take a look into that and make sure that you have the resources and links you need to know for sure. Can we print a roster with our participants' names and just check off who's in attendance? Yes, absolutely. If you have a roster, that's something that you can do. That is a way to avoid dealing with the sharing pins, sharing all the stuff at the sign-in, that is absolutely, if you have someone who can sit at the desk and just check them off, that's perfectly fine. I know some centers may not be able to do that just because of the size or because they don't have somebody to sort of man the desk, but if you can do that, that would be a great option. Someone said, we have the computer system, I think it's called My Senior Center, where they swipe cards to sign in. However, we're going to have a gloved volunteer selecting the options they want on the screen so that only the volunteer is touching the screen. That's a great idea and a great option, especially a way to engage volunteers, but still make sure that you're getting the data you need and making sure that you have not only the person's name, but what they did, so that hopefully will make your accounting and all that stuff easier. Someone said, do you think that the governor will make a decision sooner than later, or do you think it will be at the end of the month? Unfortunately, I think we don't have really any idea on that. That's really just up to him and in his office. I'll defer to Ryan. I think he's on the phone if he has anything else to add, but I think we don't know is the answer. It's just going to be whatever he and his staff thinks is best. Does the person opening self-screen, how do we verify the accuracy of that, if so? I think that's, I think, and correct me if I misunderstand this, y'all definitely chime in. But so I think that question is like, who is the person that's actually opening the senior center? What do they answer those 3 or 4 questions? Like, how do they do their temperature? How do they do have they been in contact? And I think, unfortunately, the questions, everyone is sort of just, we're having to trust the honor system. You're going to have to trust that people are answering it accurately, whether that's the person opening or otherwise. For the temperature, you could have the next person that comes in take that person's temperature. But I think ultimately, if it's just that first person and they're there by themselves, hopefully it's someone you trust and you trust that they're not going to put anyone at risk. So with the questions, I think we just kind of have to trust the answers to their own question. And then with the temperature, same thing. You can ask them to take their own temperature or have the next person that comes in to take their temperature. Someone said, how would you sanitize the puzzles and playing cards? And so I think that's a good question. There are some stuff, the CDC has some guidelines on like how you can sanitize different things. So we'll see if I can find that link and I'll include it. Specifically, I know things that are paper is kind of hard. If you have stuff that's like maybe plastic coated, that might be a little easier, but things that are like paper, it might be hard. I'll see if I can find that and include it when we send it out. And then when playing cards, are they sitting 6 feet apart while playing? Yes, you should sit 6 feet apart while playing. So that's pretty far. You would want it to be, I guess, that would be about 2 arms lengths apart. And I think cards is hard because you don't really want a bunch of people sort of all sharing the same deck of cards and that sort of thing, because everyone's kind of touching something. But you definitely want to space people out as far as possible, even while playing cards, which is kind of tricky.
Emily, I just wouldn't do it because we know how rook games are, and it's just, I know it's a big draw, but for right now, I simply would not do the card playing or the puzzle. I just wouldn't do it.
I'm going to tell you, if you're playing cards with my friends too, like it gets a little, people get lively and sharing and so it might be.
You all really need to really think that through with your board about what activities you're going to allow, because you know how rook is. You know how they get. So you got to think about it.
I will send out information or try to find the information about how to sanitize those things, though, if you do. But I agree with Roberta. It's probably anything where you're sharing items that everyone's touching. for now, it would probably be safest just to avoid those activities. Is there anyone else on the phone that has questions? We're happy to answer them. Like I said, I'll include my information, Laverta's information, everyone's stuff on there, and so that you are always welcome to reach out to us. That's absolutely what we're here for. We want to be a resource to you.
Emily, I have another question for you.
Okay.
This is Julie. Most everyone knows that we are a smaller center, and we only have 2 staff persons. And all of our volunteers are senior citizens. So it makes our job a little bit more difficult than it does people with a larger staff. And my question, and I know this is going to sound like a really stupid question, so don't shame me, but
Never.
When somebody goes to the bathroom, we are going to have someone go in there and literally wipe the entire bathroom down, because we're not going to know what they did. We don't have cameras in our bathroom. And I know, like I said, this is going to sound stupid, but how do we proceed with that without getting in their face, or, because I can imagine if I say, which stall did you use, they would probably tell me it's none of my business.
Yeah. I think that's a tricky one. The bathrooms are absolutely tricky because I think probably most of the seniors only have one, and how do you sort of wipe that down? I think it's going to look different in every center. If you feel comfortable asking your participants, hey, when you leave, would you mind wiping down the handles of the faucet and the handles of the door? That might be an option. I think it just depends, but if you want to email, I think me and you and Laverta, we could work on some sort of real practical, simple ways to go about it in different centers, because I know every center is going to be different.
Yeah. Well, I was thinking, and I've been thinking about this for a couple months now, but I was thinking, like you just said, maybe let them have a little bit of skin in the game, and let them just convey to them and appeal to them that, guys, we've got to have your help. If we are going to stay open so we can provide you with the opportunity to come here and do what you love to do, then we've got to have your help, and some of that is personal responsibility. And I think if we say it that way, in a very gentle way, then they might be more apt to want to participate and help than not. What do you think about that?
Yes, I love that. I think that's one of the things about where we are right now is we are kind of all in this together, whether we're participants, volunteers, staff. Like, it's really taken all of us to try to keep each other safe. So I love that idea.
Okay.
Good idea.
Emily, this is Connie at the Ridgely Senior Center.
Hey, Connie.
That's the hello, honey. Hi, Lavertia. This is
Hi, dear.
This is a topic, and I was waiting on someone to say this because it's a topic that I have already addressed with my seniors. I see mine every week on Monday. They come by and do a drive-by and pick up their congregate meals. And I have interviewed them and asked, when we open, would y'all be willing to help me? And everyone has said, we will do anything that is needed. If we have to clean behind ourselves in the restroom, whatever you ask us to do, we will do, because they have missed each other so much that they're willing, because they love each other enough. They don't want the entire congregation to get sick, so they're willing. So I don't think that's going to be a problem. I know we have one toilet in the lady and one in the men, so it's not a pick a stall. So mine are going to be willing. I've already talked to them. But I want to give an idea about something I'm doing and just share, because it's something that has really gone over. I have a personal garden at home, and then I've got folks in town that have gardens. So what they're doing is they're bringing their extra produce, their cucumbers, their tomatoes, anything they have left, and we spread it on a picnic table outside. And it's like our own little farmer's market each Monday. So as they drive through, because vegetables are so expensive, and as they drive through to pick up their meals that we put in their car, they'll look over and say, oh, bag me a couple of those big red tomatoes over there. And so it hasn't cost them anything. The people that have the gardens are happy to get rid of it, and it's worked great for us. So that's what we've been doing. That's a little something to add.
That's really nice.
I love that, Connie. And I think, like, that's a great, I think everyone right now needs some, feel good things that make you feel good. And that if you're garden sharing, that makes you feel good. So I love that.
Yeah. Mm-hmm. Yeah. Well, the community feels like they're helping, and then the senior is getting with that frozen meal they're taking home and putting in the microwave, they're cutting up a fresh slice of tomato, and they haven't had to get out and go in a store and buy it. It was handed to them. So it's worked great.
I love that.
Right. Did you post that, Connie?
No, I'm scared, Laverty, because I've told my seniors, put your cameras up. I don't want you to post anything because I don't want the folks in the community to say, how are they getting a get-together? And they won't understand. So I haven't. I probably should, Laverty, honestly, to just say thank you, and this is an idea that's working, because even churches could do this.
Yeah.
Churches could set up the same thing.
Community idea, yeah.
Right. So I may do that, yeah.
I love that. And please, if y'all have successes or challenges that we can share with the group, that we can either all problem solve together, or successes that say, hey, this works really well in Ridgely, maybe this would work somewhere else. Please share those with us. We want I think that something we've all been learned now as much as ever is we're kind of all in this together, and we all lean on each other. So we want to be able to share those things when we can. There were a couple more questions. Someone said, what about water fountain usage? Are we able to shut those off? Absolutely, we would. That's something I think you'll see in the overall guidance. It's a bigger document that you'll get, which is if you have water fountains, we would absolutely encourage you to turn those off and do another way, whether that's water bottles or those little things, or cups prepared by volunteer. We would encourage you to make those water fountains off limits for now. And then someone said, is spraying the surface with Lysol sufficient, or do they need to be wiped down? Which is a really good question. You want to make sure you're following whatever instructions are on the bottle of the disinfectant. So a lot of them, and I'm really bad about this myself, you have to let them sit for like 3 or 4 minutes, some are longer. Make sure you're following that instructions. Though when it says kills, 99% of bacteria, you have to follow the instructions on the package for that to be effective. We'll send out the information that we will be mailing to you, includes some of that language, but make sure you're letting that sit, or whatever the instructions say, just make sure you're following that. It'll vary by brand. It'll vary by, if it's aerosol or spray or whatever. Just make sure that you're following that. And it can be dependent, if it's a doorknob or something like that, you can spray it with the disinfectant. It doesn't have to be wiped. Just make sure that it's sitting on there the amount of time. Someone said, how will this affect the criteria of those providing respite? Example, we state they must be able to follow simple directions. That these are not simple directions, and the person with Alzheimer's or dementia may not understand. I think if it's in terms of someone who's coming in the center, you definitely want to make sure that you're encouraging. We don't want it to be something where it becomes, not a positive environment. You want to encourage, and we absolutely know that someone with dementia or other cognitive impairment may not understand. So really trying to encourage those folks to follow as they can, but also understand that we know that always isn't always simple. So just do what you can, encourage, ask your other participants to encourage, and we don't want it to turn into something that is negative or takes away from the the joy of your center. Someone said a suggestion would be small puzzles can be handled like books. So one person could do it once done, put it away, and then quarantine for a week like a book. That's a really good idea. So if you have like smaller puzzles that only, one person's working on, or even maybe one or two people are working on, you could do the same thing. You have them do the puzzle and then just put it away, quarantine it for a week, and then put it back into rotation. I think that's all the questions. Are there any other questions or concerns or anything that anyone wants to share? Okay, well, I will, if not, we won't keep you. I know that we ran a little bit over on time, but we will be sending out all of this, any information. We'll be sending out a recording. We will have another session at the end of this month. And then absolutely, if there are questions, concerns, or ideas you want to share, please don't hesitate to reach out to Laverta or myself. We're always here. We love talking to you guys, and we just want to support however we can. So be on the lookout in your email and in your mail, and hopefully we'll talk to y'all soon.
Okay. Bye, everybody.
Bye.
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 Wasn't really anything different than